Yes.
Yep.
Okay, then first up for discussion is approval of agenda. And Tim, you wanted to add an item?
Yes, we wanted to add a CER for a reagent refrigerator for the lab. Ours has gone south, and we basically had to move all of our very expensive reagents into other refrigerators that are being used for other purposes. So it really shouldn't be mixed like that, but we didn't want to waste that kind of dollar volume. So anyway, this is something that's really kind of an emergency replacement. So we've got to get it done quickly.
I'll make a motion. We accept it with Tim's addition.
Thank you, Gene. Do we have a second?
I'll second.
Thanks, John. Catherine, your vote?
Yes.
Well, a question for clarification. Where do you want it on the agenda? Under new business or?
We were going to see if we could move it up so she can go ahead and leave.
Okay.
Yeah, we'll do it. We'll do it right before consent agenda, if that's okay.
Okay, that works for me. Okay.
Okay, Gene, your vote?
Yes.
Fred, your vote?
Yes.
Yeah. So the agenda is approved with that addition. Thank you. For flag salute, John, could you lead us? And Catherine, are you okay doing the invocation this
Yeah.
evening?
Yes.
Okay, so leave it to John.
Please place your right hand over your heart and repeat after me.
I pledge allegiance to the flag of
To the bank.
the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
John, thank you.
Lord, I just want to take this time to come before you and thank you that we are able to gather here and just discuss this business. I ask that you be with us. Let us do your will and let each one of us stand on your word as we make decisions and follow through with the hospital district, that you be with us and the community. I just ask all these things in your name. Amen.
Amen.
Thank you, Catherine.
You're welcome.
Okay, this is the portion of the meeting that's set aside for public comment. The public may address the board on any item under our jurisdiction that's not on this agenda. Do we have any members of the public that want to be heard tonight? So you would take yourself off of mute and speak up if that's the case. Okay, seeing none, then we'll move on to the refrigerator for the lab.
Rebecca.
Hello, everyone, and thank you for putting this on the agenda. Unfortunately, our 1995 model refrigerator decided to die. We've kind of patched it enough so that it's running, but it's really not reliable or keeping things cold, and I can't put the reagents. We store approximately about $30,000 worth of reagents in that particular fridge. So it's a huge dollar amount. And right now, like Tim said, I feel like we're living out of suitcases. They're just everywhere, and we've tried to keep it a little bit organized so we can still operate the instruments and find stuff, but it's challenging. So the quotes that I got, there's 3 of them. The one that is the least expensive, the only reason I didn't go with that is because we are limited on space in the room that refrigerator is, because it's a very large fridge. And that particular fridge has swinging outdoors, which would not allow anybody. Oftentimes there's 2 of us in that room, one behind working, getting stuff, the other in the fridge getting samples. So there's just not really practical. So that was the reason I didn't go with the cheaper one. The middle road one, it does have some nice benefits, including being Energy Star, which I'm not sure if there's any discounts for that, but it does help with the power bill. And it also produces less heat, which in the lab, we have to keep a constant temperature of right around 71 Celsius. So big refrigerators tend to heat little rooms up pretty darn fast.
Celsius or Fahrenheit? That's Celsius or Fahrenheit?
Celsius, yeah, Celsius.
Okay.
Sorry.
I thought you meant the lab itself would have you 71.7.
No, yeah.
The refrigerator does.
Yeah. Oh, no, it's Fahrenheit. We have to keep the lab. I'm sorry. It's Fahrenheit.
I was gonna
The
say, that's pretty darn
refrigerator has
cold.
to be 2 to 8. Yeah, the refrigerator has to be 2 to 8
Okay, thank you.
Celsius. Sorry.
Is Bob Easterday there?
No.
The reason I'm asking, is that going to be part of the remodel? Will the room be bigger? Will it be able
No.
to accommodate it?
No, lab is not being impacted.
Yeah, we're staying where we are.
What's the cost?
The cost, the total of it is 6,300. It's actually like 6358.70, and that's with the freight and the shipping. And Christine was going to talk to him about that, so that's the most it will be.
When will you get it?
15 days is what they told me. As soon, so Christine, if she could put it in tomorrow, because we really desperately need it. The lead time is 15 days.
Okay. Yeah, it sounds like you've researched it pretty good. I'd like to make a motion that we accept that particular bid for the 6,300, if I can.
Thank you, Gene. Do we have a second?
I'll second.
Thank you, Catherine. Does any member of the public want to be heard on this item? Do the board members have any questions or comments they want to make before I call the vote?
Ross, I have one question. What's the warranty on the product we're looking at in comparison to the AccuCold unit? I did some research online and I couldn't find anything on the warranty being offered on that item.
From what I understood, it is a normal 1-year warranty, but I can confirm with Peyton from Fisher. So the warranty is a little bit better with the parts and labor, but with parts and labor, it means we had this with a thermal fitcher. It's not as easy as it seems either, because you end up having to ship them and then they have to bring you in a replacement. So normally with these big refrigerators, our maintenance guys are really, really good at fixing them. That's why we've had one since 1995. They go in there and they replace whatever they need to keep it going.
Thank you.
Any other board member questions or comments? Okay, Fred, your vote.
Yes.
Catherine, your vote.
Yes.
John, your vote.
Yes.
Gene, your vote.
Yes.
And I'm a yes. Thanks for bringing it up, Rebecca. Appreciate you resolving the emergency.
Thank you.
Okay, the next item on our agenda is the consent agenda. And the way this works is we approve all the items on the consent agenda with one motion and second. These are items that the staff considers routine and non-controversial. Any member of the board or any member of the public can request an item be removed from consent and discussed separately. Does any member of the public want an item removed from consent? Does any member of the board want an item removed from consent? Okay, seeing none, I'll entertain a motion.
All motion,
Okay, go ahead, Fred.
say all motion as such, Ross.
Okay, Fred motions. We need a second.
Second.
Thank you, John. Fred, your vote.
Yes.
John, your vote.
Yes.
Gene, your vote.
Yes.
Catherine, your vote.
Yes.
And I vote yes. The consent agenda is approved. That brings us to item E, reports and foundation report. I did, by the way, get a picture of an ice cold drink from Debbie Hess earlier this evening. So that, I think that was possibly the foundation report.
I think so, from her balcony in Cancun.
Uh-huh.
Told me that she was on her way to the French restaurant.
Yeah. I had a text conversation with Judy Hyatt this morning. She had had oral surgery yesterday that did not go well, so she could not appear to help with some items I had going on personally at my office with the chamber. So I'm assuming that's why she's not with us.
Thanks, Fred. Tim, did you have anything you want to address with the foundation?
No, I didn't get any report or anything from them.
Okay. All right, we'll move on to auxiliary report then.
We also did not receive a report from the auxiliary.
Okay, so there was an auxiliary luncheon that you know, you spend time with those volunteers and those dedicated folks, and it's sure makes you feel good about that organization and what they do and all of the wonderful things they do for our district. So just want to give them a shout out and appreciate what they do. So
Ross,
that
I'd like to insert something right here too. Tim and I have been talking about opening up the front lobby of the hospital pretty soon, and the Pink Ladies seemed pretty excited about that news, that opening up the front lobby might be bringing them back to the service. So when we go into yellow for the county, I think that we perhaps could entertain opening up that lobby again. So we'll see.
all right, well, keep us posted. Thanks, Mark.
Sure will.
You good?
Yeah.
Oh, it's not even out right here.
Okay,
Okay, can you guys hear me?
Yep.
yeah,
Also at the luncheon, Jenny Olson and Jenny Gear received some really special awards. I wanted to mention that. Tim awarded it.
Jeannie Pearson.
Pearson.
Harrison, okay. Harrison, yeah, I'm sorry.
do you want to talk about those, Gene?
No, Tim awarded them and they were ecstatic and they deserved it. Both of them. Jeannie Pearson worked as Heidi's job, I think, for a lot of years. And they have both been volunteers. They're just absolutely awesome ladies. And it was a special award, right, Tim?
Yes, it was. For length for years of service.
Right. I just wanted to mention since we were in there.
Thank you, Gene. Okay, then we'll move on to the medical staff. Dr. Finstead.
All right, thank you, Ross. The Pharmacy and Therapeutics Committee met on April 12th. We reviewed, discussed COVID-19 issues along with reviewing the clinic formulary from the Rural Health Clinic. We also reviewed and approved policies from physical therapy regarding Medicare plan of care, attendance, issues with cancellation.
It's fine with me, but
Yeah, but we gotta walk all the way to Walmart. We're gonna move the car.
And also a laboratory policy adjusting some of the critical lab values for notification of the physicians. Also approved was the physical therapy waiver and release of liability form. We also reviewed our regular monthly and quarterly reports, including medication error reduction program, medication shortages, MRSA monitoring, and hand hygiene. The Medical Executive Committee met on April 20th, and we reviewed and approved the above mentioned policies. We also reviewed and approved a new peer review form for the telemedicine psychiatrists that are on staff. We discussed the COVID-19 related issues and also reviewed and discussed updates to the medical staff bylaws. The Medical Quality Council met on April 27th. We will have a more extensive closed session report at the next board meeting in June.
Hello.
But one of the
I'm in the board meeting.
kind of the major highlights was the fact that we reviewed the nursing center star ratings, and that's moved from 2 up to 3 stars. So clearly moving in the right direction, and we're expecting further movement up in the next time for when those are reevaluated and released.
Yes.
And then the nursing center continuous quality improvement
Well,
committee met also on April 27th. They reviewed and approved a policy regarding pharmacy services. Also
You can
reviewed their
call Sarah Troutman.
nursing center plan of
who's in the
corrections.
ER tomorrow.
Hey, Dr. Fitstead, let me
Sarah
interrupt
can
you
go
just
out
for a
there
sec.
too, just as
Hey,
a-
Mark Gordon, you're not on mute. There you go. Please continue, Doctor.
All right. They reviewed quality assurance studies from first quarter, hospital acquired infections, hand hygiene, and environmental care rounds, along with the medication regimen review. The nursing center antibiotic stewardship component of the meeting was held directly after that, and antimicrobial monitoring was reviewed and discussed. Included in those were the antibiotic usage for urinary tract infections and antibiotic usage for wound and respiratory infections. And that's the end of my report, unless anybody has any particular questions.
Any questions for Dr. Finstead? Okay, seeing none, thank you so much.
My pleasure.
So let me right now apologize for that. I was dealing with staffing on the floor right now, so that's what my call was. I apologize.
I figured it was probably business, but we wanted to listen in.
You're welcome to. Hospital business.
Okay, Tim, we'll turn it over to the CEO report.
All right, great, thank you. Try to go through that. We've got a number of items here. Wish everybody a happy Cinco de Mayo. We had a nice celebration in the cafeteria today that our activities committee put on. Also wanted to do a quick.
Where's the tacos? I mean.
You had to be here at lunchtime. They had churros and everything. So, also just a shout out to our dietary department. I think I'd mentioned this once before, but just to get it on record here. Again, we had a unannounced survey from the county health department regarding our dietary department and the cleanliness and those issues. And we very happy to report that we scored a perfect 100 out of 100 on that. Surveyor said basically it doesn't happen too often, but she found absolutely nothing wrong. So again, we've really tried to, tell the staff what a phenomenal job they're doing, because again, you got to keep that all up all the time, because you just never know when they're going to walk in. So we're very, very happy with that. They're working great as a team together down there. Next week is hospital week. We're having a luncheon on Wednesday at 11:30 for our employees. We're hopeful that the board members can join us if they're available to help serve. And then also we have our awards ceremony right after. It's a part of that. We usually do that every year. And so just to kind of recognize those that have been here 5, 10, 15, I think our highest is 25 or 35 years this year. And so that will happen right afterwards. So it'll go probably from about 11:30 to 1:30 in that time frame. So if any of the board members can join us, we'd greatly appreciate that. The Tesla battery install went very well the other night. We have one thing that has not yet been hooked up, and that was that there was a secondary breaker that was installed, but apparently was not installed properly some time ago. They're going to come back and take that out and properly mount it. And then the batteries will be linked up and start charging. Again, the staff did a great job here in terms of making sure that the patients were taken care of and everybody remained calm and so forth. So we're very pleased at how that's going, and we're anxious to get that battery system up because in essence, it acts like a huge UPS system, uninterruptible power supply. So if anything happens with our power, it automatically just switches to the batteries without you. I mean, the lights won't even flicker. It's that fast. So again, that's something, again, with the quality of our power up here at the lake, it's desperately needed. So we'll work on that. A number of years ago, we were asked to participate in, again, a number of organizations were forming these accountable care organizations. And these are organizations surrounded, I think, around Medicare patients. And the purpose of these was to try and put them together for geographic regions so that you could manage the costs of patient care. And what happened with that is that Medicare basically created what's called a shared savings plan. And so that, again, if there were shared savings at the end of the year, then 50% of that shared savings went back to the providers and so forth. And so, like I said, we've been on this for a while, never really heard much from them, I guess, until the other day. We got a check for a little over $39,000 from them for our participation. So that's, really, really good start, glad to see that. Again, it's obviously working. And so obviously we want to continue to work on that and expand that if we can. But anyway, just, again, just let people know what's happened there. There's a couple of new law changes that I want to just kind of, there's a whole bunch of them. There were two in particular that I thought were just unusually concerning. The first was AB 858. And this is a CNA sponsored bill that would provide the use of technology that shall not limit a worker's ability to provide direct care from exercising independent clinical judgment. So if one of our systems tells them that this is a certain result, the employee has the ability to ask to override those results and go on with what they think is going on there. And again, it's actually something that is already afforded to our employees, but what this will do is codify it and put it into the employment code, which could allow then employees to come back and sue hospitals and other healthcare providers, if they make those decisions and so forth. The issue comes up is like, well, what happens if someone just decides, well, I don't agree with it, I'm going to do my own thing, and then they turn out they're wrong, so there's a lot of things that aren't addressed in this bill. And so CHA's posture at this point is to oppose this unless it's amended. And so we're going to continue to track that. Again, certainly, because of the fact that our employees already do have the right to question those things. And Mark and I were talking about this earlier. For example, if you get, artifact on a monitor, in the ER on a patient and so forth, the nurse can basically see, obviously, the patient is doing okay. They're not in cardiac distress. They have the right, obviously, to overrule that alarm that's going off. And it's those kinds of things, but this, I can certainly think of other circumstances where this could take on some other ramifications. But anyway, that was one. The second bill was SB 642, and this one you're going to love. Close your ears, Dr. Finstead. This bill seeks to empower individual physicians to dictate to a hospital what treatment and services the hospital will offer. It seeks to give each individual physician this power, despite their having no financial responsibility or liability for the consequences. And interestingly enough, this was passed in the Senate Health Committee and is now moving on to appropriations. I was just dumbfounded by that one. We're obviously following that one pretty closely, and I'm not even sure how that one would roll out to us here. But just to kind of keep you apprised of some of the things that are passing through. And obviously you guys are aware of one that I talked about before, that and that one is still moving through with no change, and that was 650. Pleased to report, I think I reported at one of our other meetings, and it might have been board PMP, that, it looked like we were going to see about an 8% increase in our medical coverage expenses for the employees' health insurance. I'm pleased to report that that actually came back at a 0.2% increase overall. So yeah, virtually staying the same. What it's interesting, because of the way it works out and our employees' ages and these kinds of things, the hospital's actual costs for the portion, and nothing has changed in terms of what we cover versus what the employee puts in. But just the way it works out, it actually creates a 3.5% reduction in the hospital's costs. So again, it's really pleased to see that's almost unheard of these days, with the double-digit increases that have been coming through for health plans and so forth. And that's what I've got. And I was going to talk about the auxiliary appreciation, but I got beat to that one. So anyway, we certainly do appreciate all they do for us, and we'll continue to work with them.
Thank
I'm
you.
doing even more. You're welcome.
Tim, I'll get a list together or get it to you on Monday about the services we need to expand. All right.
You just hold on to that list.
Okay.
Do any board members have any questions for Tim?
Yeah, actually, I have a question for Tim, but I'm sure it's going to be directed at Bob since he just walked in regarding the secondary breaker issues. Was that something that was installed by the battery installer, or is that something that's been in place that's just not working right?
That is a new breaker that's going to be added by Tesla. The reason it wasn't added during the outage the other night was that when we went to bolt up the assembly to the bus bar that the breaker assembles to, it was not the right one. So the manufacturer had sent them the wrong parts. So we were unable to install it during that first shutdown. So this shutdown will not require Southern Cal Edison to shut off the hospital, but it will still require shutting off the entire hospital at the main breaker. For the installation of the breaker itself should only take about 15-20 minutes, but it'll take several more hours to land all dozen wires, most of them as big as your thumb, onto this breaker. And what this breaker does is it feeds power out to the batteries to charge the batteries.
Okay. Well, let's hope that this one goes as smooth as the last one and we'll all be doing great.
I believe it will, and it will be a whole lot shorter.
Yeah, that's what we're looking for.
They can't do that with live wires, Bob?
I do.
If you want to touch 480 volts live, you're welcome to, but it will kill you. If you're, I mean, it could technically be done, but no one will do it because even though they might wear insulated gloves and be kneeling on a pad that is insulated, it's still way too risky.
Yeah. So, Tim, on the Accountable Care Organization,
Yes.
that $39,000, I guess, bonus we got for what we earned through that. What kind of time frame? Is that over the period of a year or a quarter or what? How?
Chet, I'll yield to Chet on that one. Do you know, Chet?
I'm here. The 39 million, excuse me, the $39,000, are you saying, Bob?
Yes. He's asking what time period?
We don't have a choice, I don't think.
No. What he's asking is, he says that 39,000 that we received from Dignity for the ACO, is that for 1 year's worth, or is that 3 months year's worth, 3 months worth, or whatever? Do you know?
Yeah.
Do you know how long, what that $39,000 for what period of time it covered?
I do not. Bob would know. I do not.
Okay. Do you know, Bernard? No, it didn't say on the check that we received. We'll ask though. So I'd certainly love to get three more of those this year, so.
I don't know if Dina can take herself off of mute, but she's sending messages via the chat feature. And she's saying that it was on a two-year performance measurement.
Oh, that's interesting, okay. She may not be able
Oh,
to.
you still want me on mute? I'm sorry.
Oh, no, that's okay.
I
No,
was
yeah,
just
go ahead and tell
listening.
us,
I
yeah.
want to participate.
We didn't know, so.
Oh,
Dina,
that
your-
it's just, sorry.
I'm sorry, your comment about the provider performance MIPS, was this $39,000 just?
That was the ACO PPO portion, and we'll be continuing on that, but we will not be participating with the GPRO, which is the group reporting. There was two different kind of multiple things going on with them. The only part that will continue past 2020 was the ACO/PPO with Dignity.
Okay, thank you.
Mhm.
And the payment was for a 2-year period, you said?
They just said it was the year 2 performance results. So
Year
I don't
two.
know if it was the
It's like-
course of the 2 years, but this was the second year we participated in the PPO portion.
But that's the first check we've received, correct?
Yes, that's correct.
That's correct. So they may not have qualified year one, so it probably represents 1 year's worth.
Thank you.
Okay, Tim, can I ask you a question?
Yes,
Okay, we had talked about it's not legal to give the employees a bonus for something they've already done. However, we could give them something for staying with us, which effectively wouldn't be the same thing, but it could work. We're going to look into that. Have you looked into?
well, we did, I think,
anything like?
yeah, that Scott reported on that last time or one of our other meetings. So from a cash perspective, we can't do that. We're trying to figure out what other options we may have to be able to do something. I don't have anything to report back yet.
Well, Scott reported at the last meeting, Tim, that we
Right.
could give a stay put bonus to
Yeah.
keep our employees
Tim,
that have been in the line of fire.
this is Chet.
Go
You
ahead.
may want to explain what we know about bill number 680,
Yeah,
which is the
No,
amount
that's
to be
that's
paid
six.
back to July 1st.
Yeah, that's 650. They're aware of 650. So there is a bill that's going through right now that would kind of mandate something along those lines. And like I said, it's not something that we want to get into. Is being fiercely opposed by CHA just because
Right.
of what's being done.
Right. I'm just-
But anyway, yeah, I don't have anything to report back yet on that.
Okay, but you're looking into maybe something for us.
We will see what we can come up with.
All right,
We'll
thanks,
work with
Tim.
Scott on that.
Thank you.
You're welcome.
Okay, any other board member questions for Tim? All right, then we'll move on to Chief Nursing Officer report. Mark Gordon.
Well, good evening, everyone. So, good news, the March and April COVID-19 numbers continue to decline. It seems to be a promising trend all over the county and actually on a national level. There were only 17 tests performed through the community testing site today. And going forward, the last 4 weeks, we've had a number of 15, 31, 24, which totals out to be around 87, which is pretty much less than 3 per day for the last 30-day period. So, I mean, those are really good numbers. The ER numbers that I'm looking at, I look at it every day, are less than 1% since the beginning of February. So those are really good numbers also. We're kind of hopeful that this kind of thing is behind us. We'll see how that goes. We are going to continue our mandatory security training with HSS. We continue to have security issues within the facility, and we've entertained a couple of bids for having private security here. Those bids that were submitted are not apples to apples. They're more like an apple and an orange. So we've asked for a second bid from one of the companies. So we're going to be definitely pursuing that very carefully and looking into that. Shannon Jimerson worked very tirelessly on several grants to propose to Kern Health Systems, as they had a couple of $1 million available for their constituents. While I realize our strategic plan was kind of placed on the back burner temporarily, we're trying to take advantage of this lull in COVID to focus some effort in this area. The grant proposals were due last Friday, and we kind of missed the boat on a couple of them. I did, however, put together a submission for 2 vehicles and 2 FTEs. I presented those on Monday, and they were accepted, and they will be considered for approval. So they haven't been approved yet, but they are being considered for approval. We also were considering looking at a hospital at home services. That has not been done on the West Coast yet. It was done on the East Coast very successfully during COVID, during the height of COVID, but it hasn't been done here yet. So we're still kind of looking at that.
Hey, Mark,
Yes, sir.
I know we've talked about this. Could you explain that more in depth to the board members so they understand what the concept is?
So essentially, this is an inpatient care program that would either supplement an admission to the hospital, or it could finish an inpatient stay at home. What it requires is a daily visit from a provider at home or a mid-level, with a nurse to visit several times a day, depending on the needs that are identified based on the orders of the physician. And the other thing is that an ancillary provider could go out there. Now, obviously, we couldn't do home, but we could do lab draws and bring them back to the facility, run the labs, and the physicians could have those results. So we kind of wanted to entertain that along with our visiting nurse service, but we're just kind of biding our time with some of those ideas. Kern Health Systems reached out to us recently with a particular case that they wanted us to do a nurse visit. They approved 1 visit, and we're going to probably entertain visiting that person at home next week.
That was BFFC.
It was
Mark.
BFFC, I'm sorry.
Sorry.
You're right, I stand corrected. But so we're going to take those kinds of offers on a case-by-case basis with a guarantee of payment. Hopefully Chet can look into some of those numbers and see if those will pan out, to see if they're worth kind of going out to do. Things that we had talked about was a cardiac wellness program. Now, Shannon crunched some numbers on that program, and she came up with a number around over $500,000 to get a program like that off the ground. So I'm not sure that that's something that we want to look at right now, but I think it's within the realm of possibility. We need to get more information about what Kern Health Systems and what HealthNet are required to offer to their beneficiaries, and see if that kind of thing will pan out. It's a cardiac wellness program based on a plant-based diet. There are studies that show that plant-based diets are very effective in fighting cardiac disease. And there's a Loma Linda cardiologist who's interested in working on a program like that. So we haven't taken that off the table yet. We just weren't able to get that grant proposal put together in time.
Yeah, there'll be other grant opportunities. The other big issue with Kern Health Systems on the funding of this, on this Cal Ames program is that they still, the actual things that the health plans will need to provide to their membership still haven't been clearly defined. There was a master list that they came up with of kind of their wish list of services they wanted the health plans to take on. They still haven't figured out how they're going to pay for them, or if they're going to pay for them. It may come down that they are required to provide them with no additional compensation. So, again, before we kind of get into a program that was as expensive as that one could be, we kind of wanted to see more information from them as to whether or not they think this one's going to survive the cut So it's still something, like I said, that has obviously proven to be very effective I think Loma Linda, the community of Loma Linda has been identified as probably one of the healthiest communities in the country because of their dietary habits and so forth. And that's what this program was built on, was trying to replicate that. So we'll, like I said, there's still some interest and we'll continue to pursue that if we think it's something that current health systems may want to go down that path.
And that is the end of my report.
Thank you, Mark. Any board members have any questions or comments for Mark?
I have a question. The thing about the in-home, is that going to be kind of like what home health used to be, or?
This is actually inpatient services at home.
Okay,
So it literally will be billed as an inpatient, but
okay.
it still hasn't been approved on the West Coast. They did it, I think it was probably a temporary thing even on the East Coast. But they were billing based on an inpatient stay.
That requires a nurse to make at least 2 visits, in-person visits a day to them. So obviously it would be a part of our home program if we were out doing the visiting services. And it also requires a physician or a provider to make a visit as well. Yeah, so, but they are paying inpatient hospital rates for that patient to recover at home.
Mark, could I ask a question?
Sure.
During our last meeting or one of the last meetings, we talked about security and possibly recruiting the volunteer sheriff department or the someone along those lines or one of the clubs just to be there with and maybe get a little bit of training and be there with a volunteer with uniform to give us something or some help periodically. Have we reached out to?
I spoke with Gene. I spoke with 2 volunteer sheriffs that I know, and they would not be interested in participating in in sitting around a hospital providing security. That's not what they signed up for the sheriff's office for.
Okay,
So,
all right. That's good. That yes. Thank you so much.
yes, sir.
Okay. Dina had added a comment here on the chat that for that in-home services, there may be a possibility that the physician visit could be telemedicine. So
Not for the inpatient service, no.
Yeah.
Maybe for the outpatient service, yes,
Okay.
but not
Thank
for
you,
the
Mark.
inpatient service.
All right.
I agree with that.
Okay, so then that brings us to the Chief Financial Officer report. And Chet, if you could do something a little different tonight, and rather than go through the detail of all the charts and all the detail in there, if you could just kind of summarize it down to the top 2 or 3 things that you think the board needs to know about how we did last month, that would be super.
The board needs to know about what?
I'd like you to shorten your report. Try and keep it to about.
Oh, that's not a problem.
About 10 minutes. And rather than go through all the detailed charts and tables, just tell us the top 2 or 3 things we need to know.
Things I need to know. Okay. You could probably choose the things that you need to know. I think they need to know about where we are at the end of March for our financials. I'm not going to go through the detail, as you said, but they need to know that we generated in the year to date for 9 months, 84 million as compared to 84 million last year. They need to know that everything was pretty much the same. After that, our deductions from revenue were 72% this year and 73% last year. And the one thing they probably should know about is the other operating revenue, which is up about double what it was last year, 413 to 229. Our total operating expenses were 22 million this year versus 20,000,009 or 21 last year. So we had operations. We were at 689,000 negative this year and 17,008 positive last year after 10 months. That brought it with the non-operating revenue from property taxes and less the long-term interest. We actually show 340,000 negative this year and $63,000, excuse me, $36,000 positive last year. The interest from the bonds will not be showing it yet because until the project is done, they have to go into construction in progress. That's my report.
Does any member of the board have any questions or want any clarification on anything about the financial report?
I just like to say it was a great report.
Thank you, Gene.
Thank you,
Okay.
Chet.
Thank you, Chet.
Chip, I appreciate your brevity. Thank you. Okay, so that brings us to new business, item G, and the soils engineering OWTS change order number 3. Bob Easterday, are you there?
Yes. Yes, this is the change order from Soils under the contract that we had going with them previously for all of the work on the leach field and treatment plant and all of those, where this is taking the samples out of the existing 1968 building to be tested for the report that needs to go to the structural engineer for the SB 1953 Seismic Safety Act. So this includes pulling the samples out of the cement block walls, out of the concrete, unearthing the foundations to determine sizes, grading of all of the beams in the ceiling structure, and putting together a report, and also then the contractors coming back and reinstalling rebar and cement block where we have to remove sections like 3 feet by 4 feet of the walls. And so this also includes the contractor that would come back and install new rebar, new cement block, patch everything back so that we are building this back sound again.
Now refresh my memory, is this reimbursable through our bond funds?
This is all part of this is the master project. This would be paid out of that 5 million that we need to spend on the of the loan.
Great, thank you.
Could I make a motion that we accept his, or accept what he's proposing?
Gene makes a motion. Thank you, Gene. Do we have a second?
I'll second, Ross.
Is that Fred? Okay, Fred seconds. Does any member of the public wish to be heard on this item? Okay, I see none. Do board members have any questions? All right, then we have a motion and a second. Fred, your vote?
Yes.
Catherine, your vote?
Yes.
Gene, your vote?
Yes.
John, your vote?
Yes.
And I'm a yes. So we can move forward with knocking holes in our walls.
All right.
All right, and then item 2, the fiscal year 2022 productivity budget. And Chet, I'll turn that over to you.
Okay, in your packet is the paid FTEs that we are using in our budgetary process. Barbara put these together They were based upon the reduction in the volumes in the departments that Tim wanted to have reduced. I was surprised that it came out actually as well as it did. You can see down at the bottom there, paid FTEs, 201.38. Actually, if you looked over the financials and you were looking at page 10 of the packet, not of that packet, but of the board, of the unaudited board packet, and you will see that on a year-to-date basis through March, we actually had 207.60. So we're only talking about, with those reductions, about 5 FTEs. Everything else is pretty much the same.
Thank you. Are there questions from members of the board? Does any member of the public wish to be heard on this item? So where are the, Chet, where are the reductions occurring?
Mostly in the inpatient department.
Okay.
Tim wanted the census taken down in both SNF and med surge. So those departments, and then the departments that would be associated with that, like dietary, just things that are respiratory therapy, for example, those things are used in inpatient services only, pretty much. Drugs charged to patients would have a little bit as well.
Again, the issue here was we did not want to overinflate our budget based upon our prior 3 years history before COVID. So we're just going back and using our volumes from this last year as our base on many of these departments.
So this brings us into what we think the reality is going to look like in the upcoming year.
It should be a lot closer.
Okay. Okay, does this, let's see, let me go back up to the top. So this requires action by the board, is that correct?
I think it's on as an action item, isn't it?
Yeah, it's an action item.
So this does not legally require action, but historically, the board has approved the budgets that Chet has presented in order to prepare the final budget.
Okay, thank you, Scott.
It's actually in the works. It'll come through next month.
Okay. So I'll entertain a motion on the productivity budget.
I'll make a motion to accept it.
Jane, thank you.
Ross, I'll second.
Thank you, Fred. Any board member questions or comments before we go to a vote?
It's a
Okay,
quick
Fred,
question.
your vote.
Yes.
Jean, your vote.
Yes.
Catherine?
I think John had a question first.
Yeah, I'm sorry, Ross. Can I ask a question real quick?
Certainly.
Okay. Now, could this change during the year? Like, I mean, is it just?
Volumes go up.
Volumes go up and down, so it's based upon volumes, right?
Okay, that was just my question for clarification. Okay. Thanks, Ross.
Uh-huh. Catherine, you want to go ahead and vote?
Yes.
John, your vote?
Yes.
I'm a yes. Thanks for your work on that, Chet. Okay, and it looks like we have a change to the meeting time for the Finance Committee. Could, I don't know what this was about. If you could give us the background. Is this Jean or Tim?
Yeah, that's me.
Okay.
We've got a new awesome board member that is volunteering and it's conflicting with her work. And so we're moving it to 1 o'clock on Wednesday, which is, I mean, it's not a big deal either way, but it would be a big deal if she wasn't there. So I don't think it needs a motion or approval. It's just information.
Thank you, Jean. Appreciate the explanation.
There's no issue with that, Scott. Okay,
It's entirely the prerogative of the committee when and where they will meet.
great, thanks.
Thank you.
At first, I thought this was a change because of Gene, but he's retired, so he shouldn't have.
I know, yeah. It's me, and I only work 2 days a week, and that's wonderful. So the time was kind of conflicting, so I appreciate it.
Well, we appreciate your work on that committee, Catherine.
Yes,
Thank you.
yes, very good.
Okay, then that brings us to director comments. And I will turn it over to Gene.
Oh, wow. I was trying to think of what I could say. Hey, everything, I love working with the hospital, and I don't know one employee or one person in there that's not great. Even Tim. So
Well, thank you.
that's about it.
All right. Fred?
I just appreciate the effort that the entire team puts into not only making the hospital a great thing, but making our job as a board of directors much easier when we come to these meetings. So thank you for everything that you guys do.
Catherine?
Sure, you want me to go next, or you want me to wait? I'm just kidding. Hey, I'm not on Facebook a whole lot, but when I am, there's always seems to be a little something going on. Kaiser's been a hot topic about what we're doing to meet their needs, what we facilitate, what procedures can they have done here. And I think there's something in the community maybe everybody's not aware of. I'm not a Kaiser patient, so, but there's rumblings out there. So I'm just hoping somewhere, somehow, with maybe one of our ads or something, we can clarify what the procedures are or how they would get treatment if. And I say that only is because not everybody that's Kaiser's on Facebook, so maybe not everybody knows. I don't know if there's been a mailer go out, and maybe I should just stay off Facebook. I've thought about that too, but
I can address the Kaiser.
you can, because I get tagged in some of these things. I'm gonna start tagging you guys if that's all right, but yeah, that would be great.
So we have regular meetings with Kaiser.
Okay.
Our last meeting was actually yesterday.
Okay.
And right now, the initial plan was we were going to have 50 lives assigned to Kern Valley Healthcare District, where we would have the patients would actually be what's called paneled, which means they still have a primary doctor down at Kaiser, but they could come and see us for all routine things without any prior authorization. We're having some difficulties with the operation of that. So we changed that, and now the only patients that are paneled are hospital employees. However, any Kaiser member can come to the Mountain View Health Center for any urgent care type need. It's not a routine thing, but any urgent care type need. If they sprain their ankle, they have a cough, cold, flu, that type of thing, they can all be seen there, and basic lab tests and imaging can be done at our hospital.
Okay. That's good to know. So and I appreciate that information because I don't really know. So I try to just like go, okay, let me check before, because I just had this wonderful training a couple hours ago, so I don't want to cross any lines there. But other than that, I just have another question about COVID testing. And we're still we do rapid COVID testing here? Yes.
At the moment, we do not. There were some issues with the reagents that came because we were having some weird results. When we first started, it was doing great. And then all of a sudden something happened with the reagents. And so we were getting some inconsistent reports saying that patients were positive for COVID when they weren't. Because we were running them against another test that we did as well. We do have the antigen tests here, and we have some other ways that we can run a rapid test. But the manufacturer is repackaging the PCR reagents and so forth that go along with that. So that should be out shortly. We don't have that in yet.
Okay, so the hospital is not doing rapid COVID testing.
We're doing the antigen testings and stuff like that, yes, which will basically show whether they have it at that point in time or not.
Okay, so that's kind of the same thing.
Kind of, it's a little bit different. Not quite as accurate as the PCRs, but
Okay, and so do they need to be showing symptoms when they come in? I'm just asking, what is the procedure? Most
I'm gonna
places,
let Greg respond. He's our
Greg.
kind of resident expert here.
I think that every case is going to be different on when it's most all of this is going to be in the ER or possibly as an inpatient. So the antigen test is not as reliable of a test. If it's a positive test, you can assume that the patient is positive at that point in time, but a negative test does not rule out infection. That's why we usually do concomitant tests with the PCR following that. So it's a clinical decision on why it needs to be done. Usually it's going to be based on clinical symptoms, but sometimes it can be done for other social issues. If someone needs to go back to a nursing home or different things, that's probably where the decision making would come in there.
okay, the reason I asked is, of course, there was, again, I shouldn't be talking to anybody, I guess, but somebody came in or somebody called, was told they had to get a prescription to get a rapid test. So they brought the prescription in, was told that, first, I guess, a couple different things. We don't do rapid tests, and was told after they presented themselves with what the symptoms are, well, I can't give you a test because now you've told me you've had symptoms. So I just want to clarify, are we doing them? Are we
The
not
issue
doing
with this
them?
specific case, and I know what you're talking about. And the issue here was that the individual did not communicate to us that they had symptoms at the time she called us. So our techs in the lab, phlebotomists who were doing those testings, if they're asymptomatic, they can go test them. But the point was, because this patient had potential positive symptoms and so forth that needed to be done by a clinical person, they weren't capable of doing that. So we didn't know that till they arrived. And so that's where some of that confusion came up from. We were able to get one of our RNs in the ER who actually did do the test for her. So, and again, I certainly understand her being upset and so forth because, again, it was just a miscommunication.
Well, and
so forth.
that's one of the reasons I bring it up. So it's not, so if I'm asked, I want to be able to present, not my opinion, but what is, what's supposed to be going on.
Correct.
So, and that's why I brought it up, because I guess there was an issue.
Yes, there was.
And I understand she was taken care of and stuff, but it was, apparently you know the story. So I just want to make sure that we can meet and we'll meet the needs with not having to have that type of episode go on.
Correct.
And I don't know how to help that, so.
My lab manager is well aware of this particular case, so she's working on that. There's been re-education of her staff and so forth as well. So we're working to take care of
Well,
it.
I need the clarification, not just for myself, but the
Sure,
community,
absolutely.
because I need to, again, get off Facebook or
You
something.
betcha.
But actually, this wasn't a Facebook issue. I just want to,
Yeah, it was
next time I'll
unfortunate.
go last,
It was
but,
very unfortunate.
so, but other than that, I have truly enjoyed working on the board. I am learning lots, and it's been very interesting, very educational, and I am grateful to Scott today for the ethics training that we had, because that is helps me know where I stand, which is very important, because I need to be kept in line sometimes. So thanks, Scott. That's
Hey,
all.
Catherine, on that Kaiser thing, I don't know all the details on what questions you were being faced with, but keep in mind, I think for the most part, Kaiser has a financial incentive to have most of their patients go to Bakersfield and get their services.
Right.
That's not convenient for the patients. And so if patients are dissatisfied with the kinds of services that they can get up here, then they need to let Kaiser know that. Say, we want more services available in the Valley.
Yeah, and I don't know, Ross, if that was really the issue. It's like not knowing what the services were that they could get. I mean, and it could have been they thought, oh, you can get services in Kern Valley. So yeah, they're like, yeah, that's even good, but yet not know exactly what could be done and where. So
Yeah.
I'll just go to the clinic now. So but that's why I had those questions also.
Sure.
Thank you.
Okay. John?
I don't have anything to add that's already been said already. So I have 3 board members, so I'll leave it at that.
All right. I think I'm about with you. The only thing I wanted to add was I'm looking forward to that employee luncheon coming up next week. And board members, if you haven't had the chance to actually serve lunches in the lunch line, it's well worthwhile. It's fun to do, and you get to see a big number of the staff, at least those that are working during the daylight hours. And I encourage you to do it if you can pull away, if there's any way you can make it. And also, you're going to be working in a fabulous kitchen because they got a 100% A+ on the public health department, where it's just unheard of that there's not some little thing that the inspectors find. So kudos to our dietary staff. And with that, I'll bring this meeting to a close. Thank you all.
One more thing real quick, Ross, just wanted to share with everybody, at the board building and planning committee, there was some requests made as we were looking at the plans for the new building down the street. Bob was able to go back and redraw that in with that one corridor that you wanted. So I've asked him to we're going to make a picture of it that we'll send out to you guys so you can take a look at that. So I actually gave more space to some of the other departments and so forth. And right now he's working on trying to get HR in there as well. So, but yeah, he was able to get rid of that other hallway.
Oh, that's great. That's great news. Terrific.
That's all I got.
Okay. Hey, Tim, thanks for all the hard work you do and in leading this organization. Keep up the good work.
Thank you.
All right, everybody. We are adjourned.
Thank you.
Thank you, everyone.
Good night, everyone.
Hey.
Good night.
Thanks, Bob. I'm excited to see what you